Clever teens that make smart choices. Well informed is the norm, you hear it in their voices. Young ladies that ain't ready for birth. Wait until the moment is right and planning it first.
As much as we may have disabilities, we are sexual beings. We have feelings.
We are also human beings. We want to have a family. One day I also want to have a family. I also want to have a husband and children.
We want to make a change in my society, in my countries, and all in the world.
I dream of the world in the future where everyone's testimony will be valued, not depending on any type of disability.
When people develop policies, they basically generalize all the policies. They make policies to cater for everybody, but then sometimes there are people that need more specific type of policies.
If I had the opportunity to request anything from the government, do better.
Currently, we have a situation whereby persons with disabilities are not fully included in all spheres of development, be economy, politics, and the social areas. We are completely left out.
It's good to learn, to bring awareness for the governments, because the governments, many governments, they are not friendly to these issues.
Do better when it comes to sexual reproductive health, services, when it comes to sexual reproductive education, when it comes to teaching the youth about their bodies and stuff like that.
We don't care whether there is funds or just a political will is enough resource for us to move forward.
Invest more on organizations that deal with CSE, sexual reproductive health rights, and all of that.
Don't leave anyone behind. We are one.
Mr. Minister, please assist me, sir. I need no services. Can I do this on my own?
Good morning, everyone. We are so thrilled to have an esteemed panel of diverse members that are going to talk about issues around disability and how they intersect with sexual and reproductive health and rights, as well as gender-based violence. We have all come together, 21 out of the 23 countries of East and Southern Africa, to this space here in Johannesburg to discuss very important issues, often overlooked in our programming, in our planning, in our resource allocation. And because it's such a special moment for UNFPA, we are celebrating our 50th birthday, as well as the ICPD at 25. So without getting into further detail about those, I will introduce the panelists and I will allow them to speak about what this intersection of disability, sexual and reproductive health and rights, and gender-based violence was like 25 years ago till now. Reflect on that, how far we've come, what we're currently doing, and what we need to continue to do.
ICPD recognized that reproductive health and women's empowerment are intertwined, and also that gender equality, equity, and empowerment of women is very, very central in any national and global development. We've realized that there's been a decline in maternal mortality ratio worldwide. Women and girls have accessed a wide range of family planning interventions or services. There's also been increased access to skilled birth attendant. There's been reduction in infant and under 5 mortality. And that is inclusive of people with disabilities. But having said all these good achievements, there's still more that we need to do as we move from Cairo to Nairobi. Adolescent birth rate still remains very high, and that leads to adolescents dropping out of school. There are still some quarters of people that are facing a high unmet need for family planning or for contraception. We also see in the region that gender-based violence remains prevalent. There is need to invest in ensuring that all the pillars of the UNFPA program in countries are integrating issues of disability. However, in terms of the implementation of this program of action, it depended on how countries understood it, how countries unpacked it, and how countries financed this ambitious program.
I would also really like to encourage other countries to make sure that they have a fully-fledged Department of Disability. Unless you have a strong department or a strong agent within department, those laws and policies may not come out clearly. Make sure that you do the legal and policy frameworks place, because that's the beginning line as a government. 2, civil society organizations. The government of Uganda ratified the CRPD. We ratified it without reservation. It means we took everything. Now, definitely, the test of the law and the policy failed because we are not addressing issues of what? CRPD. But Parliament has approved the disability law, which is CRPD compliant. We had to now to increase the categories of disability in the law to 8, including albinism and small people. Now we have added on works and housing to address the issue of what? Accessibility.
For me, 25 years ago, I think there was an invisibility of women with disabilities in both, policy and practice. Within my family, there was a very strong emphasis on not identifying as being disabled. Later, when I got married and we decided to have a child, my experience as a young expectant mother was that there was, again, an invisibility of women with disability within the society. I wanted to set up an entity that encouraged more women to enjoy, their rights within society, so to live a full and active life in society. And as an organization, we decided to do things differently, work with the media, for example, to ensure that the society is being encouraged to normalize conversations around disability, to not necessarily relegate women with disabilities in terms of their sexuality, to relegate them to being asexual or, not having the right to form, partnerships, relationships, or even to, have children and be in a marriage, to kind of push back on the laws that restrict the legal capacity of women to make decisions over their own bodies. For me, I've seen a lot of changes, both on a personal and a professional level. And for the first time for Kenya, the CEDAW committee made specific recommendations for Kenya to prioritize the rights of women with disabilities around sexual and reproductive health, around access to economic empowerment and education. So we see that as a success, but there is still tons to be done. Disability inclusion in all bodies of work adds value, and we are not moving, any agenda if we're leaving other groups out.
I'm fortunate to be South African and also have this awesome personality that comes with a lot of interesting facts about me. For one, as you can see, I'm living with albinism. I'm a young woman within South Africa, and I'm also part of the LGBTI society. With albinism, there's been a lot of progress, all thanks to Mam Nomasonto for starting the Albinism Society of South Africa. And we are now seeing a lot of people coming in front and actually taking up spaces, people living with albinism, taking up spaces in big offices or in just big platforms where we are actually seen, whereas before it was sort of taboo to even see a person living with albinism amongst the population. As a young person coming from the rural areas of KZN, I know and see the importance of sexual education, sexual reproductive health rights, and all of that. And to have people like all of us right now who actually facilitate the services and actually the fact that we get those rights is actually a great point of view, and it's actually like so great that I am part of this generation that actually has it really, I wouldn't say like totally easy, but we have it so much better than all of y'all. Inclusion of everything. Like here in South Africa, we have plus minus 18 civic society sectors. So it would be to have disability as a theme included in all those sectors. Like I said, I'm part of the LGBTI society. I'm also a young woman. I'm also black. So to have representation with amongst all those sectors of disability, if we learn to talk about like sexualities and all different aspects of a person with living with disabilities as more than just a person with disability or addressing their disability challenges, but also addressing their human perspective on life and stuff like that. The fact that they are growing, they have different facets to their personality and everything. If we start addressing everything like that, then I think we'll achieve like inclusion of disability amongst all sectors.
And of course, data. We can never be able to support countries in the absence of data, because all the policies and programs and also financing must be evidence-based.
You have much better data today of how many people with disabilities are in your country, and to some degree, what kind of disabilities that are. And we didn't have that when I stepped on your continent 25 years ago. We had very, very bad data. So we were thinking like 1% or 2% of the population have a disability. Meanwhile, today we understand it's 15. Back then, people with disabilities were not seen as sexually active. And we didn't ask the questions about it either. We had probably all sorts of assumptions. The first thing about sexuality and sexual reproductive health and rights of people with disability in Africa came actually with the HIV epidemic. And not surprisingly, that has also something to do with funding streams. One of the biggest body of research starting around 2003 comes from the HIV and disability space. So today we have still scattered data, but we have a good understanding of that people with disabilities, and in particular women with disabilities, are at increased risk of HIV. So today we understand that women with disabilities in Africa are 4 times as likely to be exposed to intimate partner violence than women without disabilities. Still huge gaps in other SRHR areas. So if you want to ask me what are the pregnancy rates of women with disabilities, we wouldn't have good data. If you ask me what is the rate of HPV, we haven't discussed this here at all. It's one of the biggest other problems in HIV. We wouldn't, among women with disabilities, I wouldn't be able to tell you, but most likely it's very high. And those people die, those women die in silence. What is the birth outcomes of women with disabilities? We don't have data on that one, good one. So there's gaps in a lot of SRHR issues. SRHR moves with whatever is also in the mainstream researched on. We have a number of SRHR problems. We understand women are more at risk. We understand certain disability groups are more at risk. For instance, intellectual disability, very little being spoken about, but a huge risk groups in terms of any sexual reproductive health and rights violation. We know that learners, regardless of their boys or girls, have less access to, or even sometimes not at all, access to comprehensive sexuality education. What we don't know at all, there's no evidence except for a few studies. I will say something to them that now we don't know what works. So now we are getting into the era where we're starting to ask what works. And that's an exciting space in terms of research. There's still a lot of things that we need to ask, and I think our government officials, they do need to ask a lot of questions about that disability indicators get put into your standard surveys.
One theme I've been hearing is that inclusion and this mainstreaming of disability everywhere. Our colleagues refer to that as the twin track approach. So in the disability space, we're talking about having dedicated programming for disability, addressing disability, information and services for young people, for women, and for men with disabilities. but also the mainstreaming part of it, so that this twin track approach is coming through in a lot of the remarks. We did mention the aspect of the humanitarian settings and crises. In emergency conflict settings, I mean, the disabled are particularly vulnerable. If you're fleeing a natural disaster, if you're in a conflict situation, if you physically can't get away quickly, if you have all of these compounding issues. So, this meeting has also had us thinking about those, more deeply, per disability, per aspect of sexual and reproductive health.
To crawl, to walk, to run, to fly. Give me a chance to live a better life.
We want to be seen as women first, and that disability is yet another identity that we have.
I can't wait to be part of the generation that changes everything, that achieves all the SDGs 2030, that actually lays out the foundation of happy life for my children and their children.
No women with disability and young people with disability anywhere should see their potential unrealized. Rights for all are within reach. It's time for urgent action from all of us. If not now, when? Without our action, the call for leaving no one behind in pursuit of Agenda 2030 on the Sustainable Development Goals will remain a far-fetched reality. Remember, colleagues, all roads lead to the global celebration of ICPD at 25 in November 2019 in Nairobi.
We want to get to a point where we're actually getting to commitments. What is it that we as a collective group here want to take to the Nairobi summit? What are the actions? What are the commitments? What are the high priority areas?
We are all created equal. And when I say we, I'm talking about humankind. Behind. Let's close the gender gaps. Let's go safeguard.
Collaboration with UNFPA and other key actors
to make SRHR services accessible.
Develop a platform where GBV prevention will be led.
Improve the infrastructure, facilities of healthy education and transportation, especially in rural areas.
To advocate for the improvement of sexual and reproductive health services.
Train our service providers in sign language on sexual reproductive health.
To advocate for rights-based GBV and SRHR.
To combine Lesotho National Federation of Organizations of the Disability.
To advocate and influence all platforms to include persons with disability.
Commit to conduct a situational analysis on disability.
Work towards accessible.
Promote collaboration with other partners.
Available.
Raise awareness and build capacity.
Acceptable.
Strengthen database for people with disability.
And quality services and programs.
Partnership and networking.
To ensure full and effective inclusion of young people with disabilities and women with disabilities.
Give me a chance to live a better life. Give me a chance to crawl, to walk.